I'm Robert Perkinson, a professor of American Studies at the University of Hawai'i at Manoa. Today's topic is a serious one: how to recover from the worst economic crisis to strike the island since the 1930s. And looking to the long term, what sort of public investments, tax strategies, and public policy interventions we can make to set the groundwork for a sustainable return to growth and to create a kind of economy more like we want, one that's more just and more resilient and more diversified, if we can, for the future. That's no small task, but we have a wealth of expertise here with us today. UH Professor Emeritus and UHERO Fellow Sumner La Croix, who's on the screen with us right now. And after we speak with him a bit, we will go to the director of the Hawaii Budget and Policy Center, Beth Giesting. Then we'll turn to Hawaii State Senator and Executive Director of Partners in Care, Laura Thielen. And finally, we'll be speaking with Local 5 organizer and longtime Hawaii advocate, Ikaika Hussey. So welcome, Sumner. Thank you for joining us this morning. We'll start with you. And my question is one that people know individually, but how bad the recession is for them, but how bad is it for Hawaii writ large right now by the numbers?
First of all, aloha, and thanks for inviting me. It's a pleasure to be here. We've had a massive decline in output in Hawaii, and that's come both from the Kama'aina economy, the non-tourism economy, has declined by double digits, but the tourism economy, which is 25% of our overall economy, once you take into account all the other jobs that are dependent upon tourism spending, not just the direct and indirect spending, but also people in the tourism industry spending and thereby supporting other people in the economy. That's about a quarter of the economy. And for all intents and purposes, that sector is pretty much shuttered. A quarter of the economy is probably running at about 10, 15%. That means we're only getting about 2.5 to 3% of output that typically would have been 25% of the economy's output. Now, if that really was the case, that we'd say lost output in the Kama'aina economy, we'd lost the tourism economy, and that was reflected in our income, then that would be an absolute disaster for Hawaii. But that hasn't really been the case. The decline in personal income is much, much less, and that's because of the massive federal relief that came this spring and this summer. The massive federal relief offset a lot of the lost income that people had from being laid off from their jobs. And we also had the Paycheck Protection Program that kept some people on their jobs, even though the businesses themselves were shuttered. It's useful just to remember that we've lost over 100,000 jobs. We had about 660,000 jobs in the state. We've lost over 100,000 jobs. There's still around 100,000 people unemployed, if not more. And so these are really horrific economic numbers. The key to reviving the economy in the short term, I'm not talking about the long term, but in the short term, is to get the tourism sector reopened. And I've emphasized for the last few months that that's a fragile process. It's fraught with danger. We're at a very risky moment in Hawaii right now.
How do you think we've done so far, both federally and in the state of Hawaii, in managing this colossal and protracted economic shock?
Here in Hawaii, there's a lot of people who are finding that their federal relief has run out, that they're down to relatively low unemployment benefits. We face some real problems. We face some real problems here in the state if the feds don't provide us with relief. From the local level, we really need to make absolutely sure that we are not delaying any further our spending of CARES Act funds. There was CARES Act funds given to the city and the state. Our biggest problem here in the state is that there is no trade-off between economic recovery and controlling the COVID epidemic. The way to get to economic recovery is to control the COVID epidemic. And we start off well in our travel bans, and everything looked really good come June, where we were down to just one, 2, 3 cases a day. But essentially what happened was we let our guard down. And then what we found was that state government had done a dismal job too of trying to prepare for what would happen if there were large outbreaks. There really was tremendous mismanagement at the Department of Health. Some of that's been remedied. I have a little bit more hope for what might happen there. But not only the mismanagement at the Department of Health, but there's been inconsistent guidelines for reopening and for closing businesses that have left people really frustrated, and for using outdoor resources. There's been terrible communication strategies. And what this has led to, just very simply, is this has been a drag on the economy.
There's also been a lot of conversations in state government about cutting state spending. Obviously, there's good reason for that because tax revenue is declining and is going to continue declining. But do you think that's a wise approach, the kind of limited cutting that has been forecast for all of the state agencies so far? Or might there be another way?
Well, I think this is one reason why it's absolutely critical for the state to be focusing on getting a successful start to tourism, because that will help bring back many of the tax revenues. We have to remember that tourists pay the general excise tax of 4.5% here in Honolulu, 4% on the other islands. Tourists also pay the transient accommodation tax. Okay, so all this tax revenue are things that will lessen the state's burden.
One other kind of big question to pivot the conversation a bit, we will eventually return to economic growth. The tourism sector will rebound. To what level, we don't know, but it will rebound. And therefore, we can grapple in earnest with the question that we've been kind of half wrestling with for quite some time, which is, how to diversify Hawaii's economy, how to make it more resilient to these sorts of shocks in the future. We have a bit of a checkered past with trying to subsidize specific industries, but I'm wondering from your vantage point, if you might lay out some guidelines that you think state leaders could follow in trying to lay the groundwork for a more diversified economy and resilient economy in the future.
The number one thing that we can do to make sure that diversification is successful is to get the basics right. And I've always talked about the basics being that we're able to control traffic so that people can get around the various cities and counties. It's important that we have a strong public school system, the K through 12 system, and a strong university, because that has offshoots into the rest of the economy. There's also a role, though, I think, for tax credits. There's a role for things like a carbon tax. A carbon tax will help us make a transition to a renewable energy economy.
I want to bring Beth Giesting onto the line. She's the director of the Hawaii Budget and Policy Center. And thank you, Sumner, again. And Beth, aloha. You're an expert among other fields in health economics and policy. And I wanted to kind of drill in a little bit on the healthcare sector, because this pandemic obviously has revealed both kind of structural faults in our infrastructure and has also thrown into stark and unflattering relief the inequalities we have in healthcare. From your vantage point, what has COVID revealed about Hawaii's healthcare system overall that works and that needs work?
Well, let's start with public health. I think that we have seen that our public health system was not in very good shape to manage and plan around a pandemic. So we found that we didn't have the resources or the skills to do effective outreach. We were not getting testing out where it needed to be. We were not crafting messages that really resonated with the people who needed it most. And that's what public health, or one of the roles of public health. And so that was a real failure. Hopefully being remedied, and we'll have a better future. Another problem that we had was having effective and timely information so that we could act accordingly. So we didn't know where outbreaks were taking place or amongst whom, and that is getting better. It still has a way to go. Now, I would say that the fact that the United States doesn't have universal coverage is a real shame, and it is something that we seriously need to revisit. I'm not quite so sure that this is an issue for the state, or that it's the most timely issue for the state. 40,000 people are estimated to have lost their employer-based coverage because of the pandemic, but we also see that about the same number of people were able to enroll in our MedQuest program. So it was kind of a wash. You know, almost 50% of the population now is covered by either Medicaid or Medicare. So even though we have seen that private insurance provided by employers is problematic, it really does need to change because it doesn't make any sense.
You know, what specifically do you think would you like to see Hawaii's state government do in the next year, say, that could position us better than we are now? And, you know, with the observation that Hawaii does have a better healthcare system and a more equitable one than most other US states.
We have a shortage of healthcare providers on neighbor islands particularly, but if we were fully utilizing all of our healthcare workforce, letting them practice at the top of their license, that is, letting them do everything that they were trained to do, we would be able to provide a lot more and better service, particularly at a primary care level. Support alternative access to care like telehealth and using the phone and email, increasing the convenience, and care coordination and navigation. I mean, those kinds of systems, unfortunately, are really hard to make happen because we are such a capitalist and private sector kind of system for our healthcare. But those are the things that could make a big difference. But the other things that really, truly would make the most difference is investing more in the things that help people be healthier, like decent housing, like a decent education, like opportunities, like reducing the stress of racial prejudice and economic prejudice.
For almost everyone in Hawaii, it's hard to make rent because the housing is so expensive. To your mind, what are the biggest priorities that we should have as we start emerging from this crisis to make sure that we have an economy that is more equitably and democratically distributed so that everyone benefits, not just the few?
And at the top of my list is housing that people who live and work in Hawaii can afford. So we need to, I just don't think that we can possibly have a good economy that supports people in the middle, not just the rich, not just the poor, unless we really focus on housing. So for me, we need to invest more in housing. And this has to be housing that people at various income levels can afford.
If state government needs to take on more responsibilities and make greater investments to ensure that we can have the kind of economy we want, do we need to look more seriously about the progressivity of the tax?
We also don't tax pensions. I think we need to give it another look. And then tax credits, as Sumner was talking about, they can do a whole lot of good, but we need to take a look at them and see which ones are doing a lot of good and which ones aren't. And I would maybe try to ratchet up the ones that help individual low-income families, like the earned income tax credit, food and rent tax credit, things like that.
Thank you very much, Beth. I want to bring on Senator Thielen to kind of help maybe pour a little bit of cold water on some of these grand ambitions, but also help us think about what might really be possible.
Government has to create a balance here in this huge recession where it is kind of spreading the pain and spreading the opportunity between, the most critical government services that are being provided to people, but also to the general population in the private sector. Keep businesses alive. For every business that shuts its door permanently now, you're going to have a number of people unemployed, number of people losing their health insurance, and they're not going to get jobs back in that business again. Plus, you're not going to have that revenue from that business going.
And it's tragic that the same people who have been hit hardest economically also are clustered in the demographics that can't work from home and are forced to go out and be exposed to the virus at more dangerous levels. So we've seen both the public health crisis and the economic crisis affect the same groups disproportionately in Hawaii.
Well, and for the ones that have been able to keep jobs, yes, that's true. But they're also the ones that have been hit the most with unemployment. And we've seen a lot of discussion about unemployment. It's not been handled well, but I do want to point out, we have zero benefits going to the many people in Hawaii that have been working 2 jobs and they've lost 1. So they're still employed. They're not eligible for state unemployment. They weren't eligible for the pandemic unemployment assistance, but their family revenue was cut dramatically. And so we've got a lot of people that are underemployed and that are hurting very badly, and they're not getting assistance from any of the unemployment.
What do you think what needs to be done first, and what do you think might be possible, or what might help us get there?
Well, if I could wave a magic wand, I think what we need to do is we have to keep people from slipping into poverty, and we need to keep businesses alive. Any business that goes out of business, this is not the time necessarily to focus on the creating new business, because that takes a long time. A new industry takes a long time. What we want to do is we want to keep as many things going as possible. I think we have to get people back into the workforce. We need to keep people in Hawaii because we're projected to have a further decrease in population, a net decrease. And so we're going to lose some skilled workers. So what I would focus on, people have talked about housing. We have the lowest percentage of home ownership in the nation, or among the lowest. Renters are particularly at risk when the governor's emergency ban on evictions eventually expires. We're predicting to see a large number of evictions. We do have some rent relief going into place now with the CARES relief money, but we should be focusing on getting landlords and tenants into some type of mediated process where there can be a forgiveness, in exchange for some of the rent relief or forgiveness of past rent, and let people move forward.
Two kind of concluding questions. One, which of these kind of priorities that you are discussing, pre-K education, sick leave, better tuition for university students, and so on, which do you think really shows promise and could move, like in the next legislative session? And 2, what do you need from the public in order to open the political space so that some big ticket items like this really can move?
I think pre-K has had a fair amount of momentum, and there is a lot of popular support for it, so that's possible. I don't see that same will now. What was being proposed at the beginning of 2020, pre-pandemic, is supposedly groundbreaking and progressive. The minimum wage increase from $10.10 to $13 over a 4-year period. That's nothing. And family leave was off the table. And this is from a Democratic controlled legislature. It was really, it was crumbs to people at 100% of the median income and below. And that's half the population of Hawaii. The legislature was not willing to take on the powers that be to provide some assistance.
Thank you, and best of luck to you in your next endeavors.
Thank you.
Take care. Let's bring Ikaika Hussey onto the program. Ikaika, welcome. Aloha.
Hey, how's it, Robert? Thank you for having me.
In terms of Hawaii politics and the possibility of moving Hawaii state government to take, at long last, some more concerted, aggressive action on, sharing prosperity, investing more fully in education and housing and public health. What do you think needs to happen for the political reality to shift?
What I really want to see is us taking the ideas which have made Hawaii successful for the last, 1,000 years, and really strategically import them into our current context, into our current crisis. We need jobs to be created. We also need food to be grown. We need to create our own energy, our own fuels, our own, forgive me for being crass, but we need our own toilet paper to be created here in Hawaii, right? These are all jobs, frankly, and industries that we should be building.
Thank you very much for joining us today and for all of your work and so many different causes. And we're going to close. Thank you to the Hawaii Book and Music Festival for organizing this event, and its partner, the University of Hawaii, and all the other sponsors that have made this possible.